So let's get right into it, Danny. You mentioned
Sure.
that in your presentation information that you guys are the first and the only, if I'm not mistaken, accredited company in South Africa. Is that correct?
Yeah, maybe just to explain to you, in South Africa, and I think it's similar to in Canada, is there's a split between cultivation licenses for cannabis,
Hmm.
obviously only for medical use,
Hmm.
and there's a processing license. So the cultivators
Hmm.
has got to conform to GAP, and that's where they stop. They're not allowed to go into the GMP arena of processing.
Right.
On the processing side, the minimum requirement is to have a GMP pharmaceutical license as a pharmaceutical company,
Hmm.
and only if you have a GMP license, you have to comply to other criteria like extraction equipment and processes and validation, etc., to achieve a cannabis license to process. So that's the two categories of licenses. Right now, Afriplex is the first and the only company in South Africa, being a pharmaceutical company, with a processing license. So
Great.
there's about five licensed cultivators,
Hmm.
and there's only one processing license. That's as recent as a month ago. That's not to say that we will remain being the only one, but we hope that for some time that we can own that space. And if you look at the way that Afriplex developed over time, you'll see why it's relatively easy for us to be compliant, because we're not a standard third party pharmaceutical contracting party manufacturing tablets and capsules in all different dosage forms, but we have almost 20 years of experience in extraction technology. And there's not a single other company in South Africa with that combination. So we find ourselves in quite a unique position.
Hmm.
We've actually developed over the years from an extraction company into a pharmaceutical company, and today we manufacture close to 200 different final products for different pharmaceutical retail companies and brands. And we export the majority of our APIs, botanical APIs that we manufacture in our extraction plant. So cannabis it's just another plant for us.
Hmm.
We've started about 5-6 years ago, even before the regulations and the legal environment changed in South Africa. We started at that time to prepare for the cannabis industry. So we were a bit ahead of the time and the industry. So by the time, that when they opened up the process for licenses, we were the first to apply. And we've waited for the licensed cultivators to get their licenses and to start producing a product. And that obviously coincide with the issuing of a processing license, so that we're in a position now, for the first time, to process within a legal framework cannabis from legal cultivators.
And how long have you had that license?
Well, like a month,
Oh,
just like
wow.
now.
You've just gotten
Yeah.
it. Oh, that's awesome. And how long was the process to get it from start of application through to being approved and finally receiving that
Well,
license?
it was about a year and a half, 2 years in total from
Okay.
the very first start. I think it's about 2 years now. But we were not, it was not really a problem for us to be compliant. It
Hmm.
was more a matter of the regulators to sort out the cultivators, to allow material to be cultivated under controlled conditions, and then being, to be processed by us. So we were really a very long time, and it comes at the opportune time for us to carry on. You'll also see there's reference in the documentation to the Cannabis Research Institute.
Hmm.
I'll give you some background to that. We're a founding member of that institute, and there's some interesting research work already, taking place there.
Okay. And the Cannabis Research Institute, is that specifically for South Africa or for Africa in general as a continent?
Well, the focus for us is now, was initially in South Africa, but we're, spreading the network into Africa as some of the other African countries come on board as well.
Hmm.
I would say that, our focus would be Sub-Saharan Africa.
Okay.
But right now, I would say that the technical capability, analytical capabilities that we have in Afriplex, I would say is the best in South Africa. And at the same time, I would imagine also the best in Sub-Saharan Africa. And I think there's opportunity, as the industry mature in other parts of Africa as well, that we could play a role there by providing technology and know-how. And it would be key for us within the context of the continent to use South Africa as the springboard and to provide that service and backup. I think we're in a better position to do that than, let's say, from Europe or Canada, because we understand the continent. We have other existing networks and business relationships, and also with academic institutions. So I can see that the institute will play a much bigger role, especially with the universities in other countries in Africa. But at the same time, we've already established collaboration with European University, with the Dartmouth University,
Okay.
and we envisage doing the same as things progress in other parts of the world, and to develop a network with other collaborators, because we realize that we don't want to reinvent the wheel.
Mhm.
There's only certain pockets of excellence, and we would be very keen to work with other institutions and other organizations. So that'll be the drive going forward.
Great. And so I do have to ask, your company started as, is it as a pharmaceutical company?
We started off as what we would call, a HACCP accredited extraction facility. That's in 2001, almost 20 years ago. And then over the years, you'll see also that there's a timeline. You'll see that, the different aspects of the business in that presentation. But we've moved from the extracts into food and beverage,
Okay.
and we've established a very solid business on the food and beverage side, which is separate from the current Afriplex business, where we focus mainly on emulsions, flavor development, and food and product concepts. Whereas on the current Afriplex platform, that's pharmaceutical, with two main components: the extraction business, and then that of final product dosage manufacturing.
Okay. And the company itself, is it a privately owned organization or is it publicly traded?
No, it's a private. It's a family-owned business, and yes, there's other activities within the group of companies associated with Afriplex, but it's a private company.
Oh, that's
We
great.
also own some farming operations, and some other industries.
What types of things do you farm?
We're our back. What type of
Yeah, what types you said you're in the farming business as well, right?
farming? Yes, yeah. So we since the start of Afriplex, there was a need for us to develop a sustainable supply of strategic raw material, mainly botanical plants, medicinal plants. and that led us to own our own farming operations where we grow the specific plant material that we need for our operations, like pelargonium, rose hips, uzara, buku, mainly South African botanical plants. But because of the quality requirements and the need to secure supply, we had to go back in the supply chain and ended up having our own farming operations,
Oh, wow.
which is very unlikely for a pharmaceutical company to have. But that
And
was just the historical development of the company.
okay. And what are some of the end products from the things that you grow? Give me an example.
Well, if on the farmers, maybe I'll start on the food and beverage side.
Hmm.
We've developed, to give you a good example, we've developed a additive from a botanical source, which allow you to produce sulfur-free wine,
Oh, wow.
and 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 um, and that we did in a joint venture with one of the biggest wine companies in South Africa.
Hmm.
Now that was developed from a botanical source, and it's almost like it works on the principle of high levels of antioxidant, giving a preservative effect to wine.
Hmm.
And so from last year, we've seen the first sulfur-free wines being produced in South Africa. And you will most probably see that in Europe and other parts of the world because there's worldwide patents,
Hmm.
not helped by us, but by our partners here in South Africa. Um, so that was, and that's produced from a specific botanical tea. We developed that API, developed the process jointly with them, and that's quite a unique application. Another example that I can give you on the wine side is that we've developed a range of wines for mainly the Middle Eastern markets,
Okay.
where there was a need for wines like Sauvignon Blanc, Chenin Blanc wines, but not derived from the grape and also alcohol free. So you would find in the market alcohol-free wine where you make wine and you strip the alcohol,
Right.
which also one of the businesses that we have where we do that provide that service to the wine industry. But that's then alcohol-free wine. We've changed we've turned that process the other way around, and we've built up a flavor profile from up to 30, 40 different flavor components to replicate a Chenin Blanc or a Sauvignon Blanc wine.
Hmm.
So that's on the food side, nothing to do with a pharmaceutical. And there's quite a number of other. There's some very well known brands where we supply the extracts, flavor extracts, and doing the formulations for final food and beverage products. We don't manufacture the final food and beverage products. That's subcontracted by our customers, or we subcontract. Whereas on the pharmaceutical side, we manufacture the final products. So that's on the food and beverage side. On the pharmaceutical side, we manufacture about 200 different products for some of the leading brands here in South Africa. We manufacture tablets, capsules, effervescents, liquids, like appetite depressing products, cold and flu syrups for kiddies. There's a whole range, mainly in the complementary medicine market because it's natural products. We try to stay away from the allopathic medicine side,
Right.
and focus more on complementary and natural medicine.
Okay. That's quite a wide range. Having more than 200 different products is quite extensive. So, in terms of what you produce or from your extraction or processing for the cannabis side. Give us some idea as to the scope of that part of your business.
Well, we're going to keep in mind that it's only now the start.
Hmm.
We've started getting the first material into our processing facility.
Hmm.
We started on the analytical side about a year and a half ago, analyzing CBD products and cannabis products that's available either legally or illegally in the market to get a hand on the analytical side of cannabis products.
Okay.
So what we will do is we will start extracting,
Hmm.
and we will produce a full range of cannabinoids, whether it's CBD or some of the minor molecules, the THC and terpenes. So uh, we will do that extraction, but at the same time, we're taking that into drug delivery systems. So you'll see there's a reference to liposomes.
Hmm.
We've done a fair amount of work on that as well already. And that was before we've received the license. That's going back in the last 2 years. Our objective would be to find unique drug delivery systems. If you look at the current market, 2 years ago, everyone wanted to produce CBD.
Hmm.
I mean, that was the drive. The drive is not CBD anymore.
Right.
We're looking at the minor cannabinoids. We're looking at the CBNs, the CBGs.
Hmm.
To extract that, we're looking at genetic material to provide higher levels of some of the minor cannabinoids.
Hmm.
And our processing approach, we have our own in-house processing skills and technology.
Hmm.
And the reason for that is that before Afriplex, where we were, I would say, the dominant player from the South African platform in designing and building turnkey separation plants, not only in South Africa, but in the Middle East and Scandinavian countries and South Korea. So our background before Afriplex was that of chemical engineering and building separation plants. So we're quite familiar with separation technology, whether it's CO2 extraction or ethanol extraction plants or gas hydrogen separation with membrane technology or ion exchange. We understand that field. So in Afriplex, our focus would be to bring a new approach to separation technology, and we've got some pilot plants and that we're working on at the moment.
Hmm.
Because if I use the example of the CBD is not. I mean, CBD has become a commodity very quickly.
Hmm.
So our challenge and that of all of the extraction companies, I believe, would be to stay ahead of the game and look at the next wave of what can be done with THC and derivatives of the THC,
Right.
and some of the minor molecules, some of the minor cannabinoids. And then also in parallel to that, we're working on liposomes, but we're working also on nanofiber technology, whereby we intend embedding cannabinoids in nanofibers, which open up a completely new drug delivery system. So that's where we have to find our niches, and not being captured in cannabis as a commodity. We have to move out of that, and that's our main challenge.
Okay. And do you see your techniques and the way that you're approaching what you're going to be doing as you move forward now with being licensed? Do you see your market how far outside of the borders of South Africa? What are you looking for in terms of your marketplace?
Well, it's clear for us, that South Africa is too small market for us. We think that we could, within 5 years, we could process up to 300 tons of dry material.
Hmm.
coming from cultivations in South Africa. We have the capability within our site, with obviously with additional equipment, to process up to 300 tons.
Mm-hmm.
It's achievable within the next 5 years. So all of the infrastructure systems, and people, and and obviously the license to do that will allow us to do that. Now that market, the market in South Africa is just too small.
Okay.
Just to give you an indication, right now we manufacture about 70% of the CBD products in South Africa.
Mm-hmm.
I'm talking about tablets and capsules and oils, etc.
Mm-hmm.
And but that's still consume currently in South Africa. Only CBD is allowed. No THC and no broad spectrum or full spectrum. Not currently. That may change with time, but right now it's CBD.
Okay.
So, but even with the 70% that we manufacture, it's still relative small quantities of CBD isolate going into those products. So if we look at it from an extractor point of view, and the amount of material that will become available in South Africa within the next year, 2 years, the only way that we can take that to market would be outside South Africa. So right now, it is the first time for us to do so. We've waited for the license to come in place,
mm-hmm.
but it's to look for partners outside South Africa. That'll be our main drive, because if we can't find it outside South Africa, the amount of material that could be processed in South Africa will be limited. I don't foresee any problems with the supply side. We've started entering supply agreements with the licensed cultivators in South Africa, so mm-hmm. they're waiting for us to give them guidance on what to grow and how to meet quality requirements, mm-hmm. which is also a big challenge for us to ensure that there's quality material being grown, so that we can get quality material into our GMP facility. Because if we can't get that, then you're stuck. So we will start now looking for opportunities and partners outside South Africa. And it's for that reason that we will now start reaching out to see where we can find suitable partners to work with us. Not only on the supply side, but also to work with us on product development and to work with us on some of the research projects that we've got online.
Okay, and then I was going to ask, as you were speaking there a moment ago, do you have a template, let's say, or a footprint of some other model that you're following, considering that you've just gotten your license? So, having just received your license, how are you going forward with your processes in terms of, ensuring that I know from engineering and technical standpoint, product goes in one way, you do your calculations and product comes out on the other end. But I'm talking more from a large scale production side. What's the footprint that you are looking to for best results, best product, best quality product? And the reason why I'm asking that is because looking at different markets around the globe, there's been that consistency, I guess, in some ways, of there being a lot of talk about the quality of the product, that the quality is not there, and therefore the market is being flooded with, lesser than in terms of quality. So I'm just wondering, to kind of overcome that hurdle, what examples are you looking at, or who are you looking to in terms of ensuring that the first set of products that will be coming out of South Africa and coming out of your facility are at the highest standards that they can be?
Yeah, let me first say that we've been through this exercise with other botanical plants and material before in the last 20 years. So for a lot of the operators currently in the cannabis industry, they only started 4 years ago. We started 20 years ago battling with the challenge of getting high quality material into a processing facility. So, I've mentioned the agricultural side of it. The model for us, we want to model what we've done on the other side with other botanicals. We went back and to ensure quality material at the cultivation stage, and then to apply quality standards from that back into the processing and to the final product. So the whole concept of you'll see that we use the business model of source to shelf, and that's exactly what you see in the cannabis industry of seed to sale or whatever they call it.
Yes,
with the traceability systems, etc. But that's exactly what we're doing. Ever since we started the company and working with other botanicals, we control the quality of material from the cultivation site right through. So all of the quality problems that you now see all over in the industry, contamination with insecticides and pesticides and aflatoxins and whatever the case may be, heavy metals, etc. That's not new to us. We're quite well aware of that. That's not to say that we have all the answers, but we understand the processes and we understand why you need that. And quite frankly, that's about my biggest challenge in South Africa is to get that message conveyed to the cultivators. We've got a long way to go. And it's for that reason that we've decided to step into that space. We've been there before, and we've got our own operations. But I won't say I'm skeptical about what the current cultivators can do, because keep in mind, it's an industry in its infancy in South Africa. And you would have seen the same in other parts of the world, that the cultivators would start cultivating. They don't necessarily come from a scientific agricultural background.
Right.
They come from all walks of life, and then to instill within the importance of quality at the pharmaceutical level is extremely difficult.
Right.
So if you ask me what will happen in the next 12 months in South Africa, we will continue to find the sweet spot with respect to quality. I think a lot of the cultivators will just not make it because they will never get to those. They never get to those standards. For instance, we will not take material in from a cultivator that's not audited and accredited by us. Now, I know some of the cultivators, if I send my audit team, it's a pharmaceutical audit team, they will fail. They will fail from the moment they walk into the facility, they will fail. So if you ask me what is our plan and what we will do is I have already a team working on those aspects to standardize and to set the standards for cultivation. And as extractor, that's not exactly where I want to be. I want to extract.
Yeah, you want to be on the processing side
and move on in the supply chain to get final products out. That's what I want to do. But we've seen it in the business before. If you don't get your hands dirty, you don't go in there. And in some cases, you may have to invest into it. You may have to provide the funding. You may have to participate to get it right.
Right.
So our drive also within the Cannabis Research Institute is to set the standards that we would need on the cultivation side. We will set the standards for the extraction. We'll set the standards for the final products and take control of the standards, because the standards is not going to be provided by the government, not in South Africa. You may be in a fortunate position in Canada, But in South Africa, they set the guidelines, but they don't set the standards.
Oh, wow.
You have to take ownership and to
Okay.
set the standards yourself.
Okay.
It's self-regulating to a certain extent.
Yeah, that's very interesting. I think, I don't know for certain how many other jurisdictions have that self-governance, and I will probably guess not many. Most of the other areas, Canada, UK, Australia, Israel, most other areas have government regulation, and
Yeah.
obviously
Well,
the
we,
US.
well, we, we've got the government regulation that's in place. But if you take, for instance, now the Research Institute, government is not government in South Africa is not driving that process to to get research organization together and to get research coordinated in the cannabis space.
Right. Yes.
It's the private sector that will drive that. In South Africa, obviously, the government has got much bigger problems to sort out, so that it's left to the industry to do that. So, but to just come
And I
back to
guess
your
in a way
original
too,
question, yeah.
I'm sorry. I was going to say, and I guess in a way too, not that self governance is ever a good thing because, it's always, well, are you going to put the fox to guard the chicken coop, right?
Exactly.
And you don't necessarily want to do that. But at the same time, I think in a way, because the industry is so competitive and because those players in the industry that are not putting out the best consumer good that they can or that's expected, they're getting sidelined very quickly. So, if you don't have your own measures in place to make sure that at least you're meeting some set of standards, then at the end of the day, your product isn't going to survive within the industry.
I totally agree with you. I think, but it's also to do with whether you've got a short term or a long term approach to what's happening in the industry. We're in it for the long haul. Whereas I won't say the majority, but a lot of the other parties that we see going into cultivation is almost as if they see the cultivation it's a gold rush. There's money to be made, but they don't know exactly how to get to the end result. They think if they've got a plant, if they've got a farm, and they can put down some infrastructure to grow, and they get a master grower from the States to grow for them plants, then they think they're there. But they've only touched what you really need to put in place. And
That's
with
right.
you being close to the industry for a long period of time, you will understand that. They don't understand that.
Yeah,
They
they've
don't
only reached
understand that
first
there's a
base.
lot more.
Yeah, they've only reached first base and they think that they've hit a home run. And
Yeah, so
that's the challenge. Yeah.
yeah, it's on. I've seen a very good example when they've opened up the market for CBD products. We've seen products being flooded from all over the place, being manufactured in non-pharmaceutical facilities, and we've analyzed it. We've got a very good cannabis laboratory in place with very good standards, and we've analyzed the products, and it was in one survey that we did of about 180 products. Something like 150 products that was out in the market, either legally or illegally, were so heavily contaminated with solvents and insecticides and pesticides and other stuff and micro that you shouldn't touch it. And it was out in the market. So what we did was we said, okay, fine, we're not going to join that rush. We'll set the standards. It took us some time, about 6 or 8 months since they've opened up the regulations, and we've set good standards to understand the analytics. You need to understand the analytics. Then on the analytical side, you need accredited laboratory. You need the right people and protocols and procedures in place. So we've established that. Then we've got a very strong product development team, and for the big brand companies in South Africa, pharma brand companies in South Africa, we've developed some very novel, not only CBD, but CBD combinations with other botanicals. We went through that process. We went through the process of stability trials and all of that. And then about 4 months ago, the first products left our manufacturing site, going out into the marketplace. Really good quality products, well researched, well formulated, manufactured in a GMP facility. It's got the Cannabis Research Institute accreditation mark on it. So we went through all of that validation process. And what was interesting to see was where 9 months ago, there was a whole range of products scattered all over the health shops and in the pharmacies and different places. And now, all of a sudden, and also with that went a huge consumer education drive. Mm-hmm. We spent a lot of money with some of the media houses that came on board with us to start the education process. We've targeted the pharmacies and the pharmacists. We've targeted the medical practitioners. And we've managed to get the big pharma retail companies on board to work with us, to get their pharmacists, the people in this, in the pharmacies, to get them trained. And then we moved on to the consumer, educate them. In our case now with on CBD, because that's the main thing. Mm-hmm. Educate them on CBD, the CBD use, also obviously with that within the context of cannabis. And the interest was massive. Oh wow! It was incredible how the consumer latched onto and expressed a need for reliable information. Mm-hmm. And what we're seeing in the marketplace now, you see the shift. You see the shift away from the sort of peripheral products. The consumers start understanding, and that's within a short space of time, about 6-9 months. Wow. They start understanding the exposure that they have with respect to unsafe products. Right. They've never realized that they should be more concerned about the contaminants than the cannabis. Mm-hmm. And it's an educational drive. Just to give you a good example, the biggest media house in South Africa approached us about a month ago to do a consumer educational drive in South Africa. They're making available all of a very large percentage of their print capacity and media to launch this initiative. And that in May of this year, we will have in all of the major centers the opportunity for the consumers to be trained and educated by professionals, by pharmacists, by doctors, okay, by qualified people who understand cannabis, and with that you take it to a next level, and that's what's important for us, and we're part of that process. So if I put all of that together, you'll see in a very short space of time the consumer understanding the quality requirements. So if I can go back to what we've discussed on the cultivation side, the consumer will be ahead of the cultivator. And in the past, it was the other way around. Someone mm-hmm. cultivating material, feeding the consumer. Mm-hmm. The consumer will be educated, and he will understand that if the material comes from a non-accredited cultivation site, that they should not use it.
Mm-hmm.
So I think, so if you put all of this together, we'll see very interesting developments in the South African market, which maybe you've already seen it in Canada. We're behind, behind you in the industry and the development. But I would imagine it's the same trends that you've seen in your country as well.
Absolutely. You see it here in Canada. It's also very known in the U.S., and it's one of those things that um, some of the cultivators are, pretty much closing up shop because the product that they're putting out is no longer appealing to the
Mm.
masses as they were maybe 3 4 years ago, where it was just, everywhere you turn it was just everywhere.
Yeah.
Now there are a lot of differentiators and people are more understanding, and as you said, they're educated to the extent that they know what products are good. They're understanding what to look for. You will still have that small percentage of mishaps as we had a few months ago with quite a few incidents with the vape products, people that were vaping
Mm. Mm.
and were
Yeah.
unaware of what was in, and it was the same thing. They're walking into a store that is unlicensed, that's just run by, somebody woke up one morning and says, "Hey, I think I'm going to open up a smoke shop." And they
Yeah.
just get a bunch of products put on the shelves and people just go buy them, unfortunately. And then, a number of people died as a
Yeah. It's
result of
terrible.
contaminants and all kinds of stuff within those products, which is very unfortunate that someone should have to lose their lives over something that's supposed to be produced for, preserving life.
Yeah.
So it
Yeah.
really was a bad situation. But yeah, we've seen that here, and I think you're absolutely right. The market will dictate. I think at the end of the day, I'm certainly no expert on this subject matter or in this field. I'm relatively green, like everyone else, in terms of learning. Um, but from the research and the number of people that we've been able to speak to so far, I do think that the market will be dictated by the consumer demands, and
Yeah.
people are going to
Yeah.
have to produce those products that the market is demanding, or that the consumer is demanding. Sorry, and those that do will succeed, and those that can't or won't will ultimately fail.